Millions of people are living with prediabetes right now, and most of them have no idea. The reason is surprisingly simple. Prediabetes rarely causes dramatic symptoms. Instead, it sends quiet signals that are easy to dismiss as stress, getting older, or simply having a busy life. By the time many people realize something is wrong, their blood sugar has already been elevated for years. The good news is that prediabetes is often reversible. When it's recognized early, healthy lifestyle changes can significantly reduce the risk of developing type 2 diabetes. That's why knowing these subtle warning signs could make a real difference for your long-term health. Today, we're going to explore 10 silent signs of prediabetes that many people ignore. Some may surprise you, and one of the most overlooked signs appears much later in this video. So stay with me until the end, because recognizing even one of these symptoms early could encourage an important conversation with your healthcare provider. Welcome to Smart Health Daily, where we make health information simple, practical, and easy to understand, especially for adults over 50 who want to stay healthy, active, and independent for years to come. Let's begin with the first warning sign. Number 10. Feeling unusually tired. Everyone feels tired from time to time. A poor night's sleep, a busy schedule, or emotional stress can all leave you feeling drained. But persistent fatigue that doesn't seem to have a clear explanation deserves attention. When blood sugar levels begin rising, your body's cells don't use glucose as efficiently as they should. Even though there's plenty of sugar circulating in your bloodstream, your cells may struggle to use it effectively for energy. As a result, you can feel tired even after getting enough sleep. Some people notice they no longer have the energy to complete activities that used to feel easy. Others find themselves needing an afternoon nap every day or feeling exhausted after routine tasks like grocery shopping or housework. Fatigue alone doesn't mean you have prediabetes. Many medical conditions can cause low energy. But if tiredness persists for weeks without an obvious reason, it's worth discussing with your healthcare provider. A practical habit that may help is paying attention to your sleep, staying physically active, and scheduling routine blood sugar screenings if you're over 45 or have additional risk factors. Now let's move to another symptom that's often mistaken for something completely unrelated. Number 9. Increased thirst. Have you noticed yourself reaching for a glass of water more often than usual? Perhaps you wake up during the night feeling thirsty, or maybe your mouth always seems dry no matter how much you drink. As blood sugar rises, your kidneys work harder to remove excess glucose from your bloodstream. To do this, they produce more urine, which causes your body to lose more water. That loss of fluid naturally triggers thirst. Many people assume they're simply dehydrated because of warm weather or drinking too much coffee. While that may sometimes be true, persistent thirst combined with other symptoms shouldn't be ignored. One helpful tip is to carry a reusable water bottle and pay attention to changes in your drinking habits. If you're constantly thirsty without a clear explanation, mention it during your next medical checkup. Number 8. Needing to urinate more frequently. This sign often goes hand in hand with increased thirst. If you've started making more trips to the bathroom during the day or waking up multiple times every night to urinate, your body could be trying to remove excess sugar through the urine. Many older adults assume nighttime bathroom visits are simply a normal part of aging. Sometimes they are, but frequent urination can also be one of the earliest clues that blood sugar isn't being regulated as efficiently as it should be. Of course, urinary tract infections, prostate enlargement, certain medications and other conditions can also cause similar symptoms. That's why it's important not to jump to conclusions. Instead, notice whether this change is new, persistent, or accompanied by other signs on today's list. Keeping a simple health journal can be surprisingly helpful. Recording changes in thirst, urination, sleep, and energy may help you identify patterns that would otherwise go unnoticed. Now here's a symptom that many people never connect with blood sugar at all. Number 7. Blurred vision, that comes and goes. Most people assume blurry vision means they need stronger glasses, and sometimes that's exactly the reason. But fluctuating blood sugar can temporarily change the shape of the eye's lens by affecting fluid balance inside the eye. As a result, vision may seem blurry one day and clearer the next. Some people notice difficulty reading small print. Others find road signs slightly harder to read than usual. The important point is that the changes often come and go. That inconsistency causes many people to ignore the symptom. Regular eye examinations become increasingly important after age 50, not only to check your vision, but also because eye professionals can sometimes detect early changes related to overall health. If you notice unexplained vision changes, don't simply assume it's part of getting older. It's worth having both your eyes and your blood sugar evaluated. We've already covered 4 subtle warning signs that many people dismiss as normal aging or everyday stress. But we're only getting started. In the next part, we'll discuss a symptom that many people notice on their skin without realizing it could be connected to rising blood sugar, along with several other warning signs that often appear months or even years before diabetes is diagnosed. One of them is so commonly overlooked that many people don't mention it to their doctor until much later. Number 6. Dark patches of skin. This is one of the most overlooked warning signs of prediabetes because it doesn't cause pain or discomfort. You may notice areas of skin becoming darker, thicker, or slightly velvety in texture. These patches often appear on the back of the neck, under the arms, around the groin, or sometimes on the elbows and knees. Many people assume it's simply aging, sun exposure, or poor hygiene, but in some cases, these changes can be related to insulin resistance, which is one of the earliest stages of prediabetes. When your body becomes less responsive to insulin, it produces more of the hormone to compensate. High insulin levels can stimulate skin cells to grow more rapidly, leading to these darker patches. This skin condition doesn't confirm that someone has prediabetes, but it should never be ignored, especially if it develops alongside other symptoms we're discussing today. If you notice new or unexplained skin changes, it's a good idea to schedule an appointment with your healthcare provider. A simple blood test may provide valuable answers. Now let's move to a symptom that many people blame on getting older. Number 5. Slow healing cuts and bruises. Have you ever noticed that a small scratch seems to take much longer to heal than it used to? Perhaps a minor cut stays red for weeks, or a bruise seems to linger much longer than expected. Healthy blood sugar plays an important role in your body's natural healing process. When blood sugar remains elevated over time, circulation may become less efficient, and the body's ability to repair damaged tissue can gradually slow down. This doesn't happen overnight. It's often a gradual change that many people barely notice until they compare how quickly they used to heal several years ago. If you have a cut or sore that isn't improving, especially on your feet or lower legs, don't ignore it. Keeping wounds clean, monitoring them carefully, and seeking medical advice if healing is delayed can help prevent more serious complications. But before we get to one of the most overlooked warning signs, there's another symptom that many people mistake for normal aging. Number 4. Tingling or numbness in your hands or feet. Many people assume occasional tingling is caused by sleeping in an awkward position or sitting too long, and often that's exactly the reason. but persistent tingling, burning sensations or numbness can sometimes be an early sign that elevated blood sugar is beginning to affect the nerves. This usually develops gradually. At first, it may feel like your feet are falling asleep more often. Some people notice a mild burning sensation at night. Others describe a feeling similar to wearing thin socks, even when barefoot. There are many possible causes of numbness, including vitamin deficiencies, circulation problems, and spinal conditions. However, if these sensations become frequent or continue for several weeks, it's important to mention them during a medical appointment, rather than assuming they're simply part of aging. Early evaluation may identify a treatable cause before more significant nerve damage develops. Now here's a symptom that surprises many people because it seems completely unrelated to blood sugar. Number 3. Constant hunger even after eating. Have you ever finished a full meal only to feel hungry again an hour later? That can be frustrating. When insulin isn't working efficiently, glucose has difficulty entering the body's cells. As a result, the cells continue signaling that they need energy, even though plenty of glucose is circulating in the bloodstream. This creates a confusing situation. Your body has fuel available, but it can't use that fuel as effectively. Some people begin snacking more frequently without understanding why. Others notice stronger cravings for sweets or refined carbohydrates. If this pattern becomes persistent, try focusing on balanced meals that include lean protein, fiber-rich vegetables, healthy fats, and whole grains when appropriate. These foods tend to help people feel satisfied for longer, while supporting healthier blood sugar control. Remember, hunger by itself doesn't mean you have prediabetes, but when it's combined with several other signs we've discussed, it's worth paying closer attention. We've now covered 8 warning signs that often appear quietly and develop gradually over time. In the final part of this video, we'll reveal the 2 signs that many people overlook until much later, explain why regular blood sugar screening becomes increasingly important after age 50, and discuss simple lifestyle habits that can help reduce the risk of progressing from prediabetes to type 2 diabetes. The final sign is one that many people experience every day, without realizing it could be their body's way of asking for help. Number 2, frequent infections. This is a warning sign that many people never associate with blood sugar. Do you seem to get urinary tract infections more often than before? Do small skin infections take longer to clear? Have you noticed recurring gum problems or frequent yeast infections? When blood sugar remains higher than normal for long periods, it can affect how well your immune system responds. Elevated glucose may also create an environment where certain bacteria and fungi grow more easily. That doesn't mean every infection is caused by prediabetes. Far from it. But if you begin experiencing repeated infections without an obvious explanation, especially alongside other symptoms we've discussed today, it's worth mentioning to your healthcare provider. Good daily habits can make a real difference. Practice good oral hygiene. Keep your skin clean and moisturized. Stay hydrated. And don't ignore infections that keep returning or take longer than expected to heal. Now we've reached the final sign, and it's one that many people dismiss because it doesn't seem serious at first. Number 1, increased cravings for sugary foods and refined carbohydrates. We've all craved something sweet from time to time. That's completely normal. But if you find yourself constantly craving cookies, candy, soft drinks, pastries, or other sugary foods, your body may be trying to tell you something. As insulin resistance develops, your body's ability to move glucose into cells becomes less efficient. After eating refined carbohydrates or sugary foods, blood sugar can rise quickly and then fall more rapidly than expected. This cycle may leave you feeling hungry again and craving another quick source of energy. Over time, this pattern can become difficult to break. Many people blame themselves for a lack of willpower. In reality, changing blood sugar regulation may be contributing to those cravings. One practical strategy is to build meals around protein, fiber, and healthy fats. For example, choosing eggs with vegetables for breakfast instead of a sugary pastry may help you stay satisfied longer. Replacing sugary snacks with nuts, plain yogurt, or fresh fruit in appropriate portions may also help reduce frequent cravings. Small, consistent changes often work better than trying to overhaul your entire diet overnight. Now let's take a step back and look at the bigger picture. Prediabetes usually doesn't appear with flashing warning lights. It often develops quietly over several years. That's why recognizing these subtle changes matters. Today we discuss 10 possible warning signs: persistent fatigue, increased thirst, frequent urination, blurred vision, dark patches of skin, slow healing cuts, tingling or numbness, constant hunger, frequent infections, and ongoing cravings for sugary foods. It's important to remember that none of these symptoms alone confirms that you have prediabetes. Many other medical conditions can cause similar signs. The only way to know for sure is through appropriate medical testing. That's why routine health checkups become increasingly important after the age of 50, especially if you have a family history of diabetes, are overweight, have high blood pressure, or live a physically inactive lifestyle. The encouraging news is that pre-diabetes doesn't have to progress to type 2 diabetes. Research has shown that healthy lifestyle changes can significantly reduce the risk. For many people, regular physical activity, a balanced eating pattern, maintaining a healthy weight, getting enough sleep, managing stress, and following your healthcare provider's advice can all make a meaningful difference. Remember, progress doesn't happen because of one perfect day. It happens because of small choices repeated consistently over time. A short daily walk, choosing water instead of sugary drinks, adding more vegetables to your meals, scheduling that overdue health check. These simple habits may seem small today, but over the months and years, they can have a powerful impact on your overall health. If any of the symptoms we've discussed sound familiar, don't panic. Instead, use this information as motivation to have a conversation with your doctor or healthcare provider. A simple blood test can often determine whether your blood sugar is in a healthy range and whether additional steps are needed. Early action gives you more options, and that's exactly why learning about prediabetes is so valuable. If you found this video helpful, please like, subscribe, and turn on notifications for more simple health tips designed especially for adults over 60. I'd also love to hear from you. Which of these warning signs surprised you the most? Or have you made lifestyle changes that helped improve your blood sugar? Share your experience in the comments below. Your story may encourage someone else to take that important first step toward better health. Remember, small changes today can protect your health for years to come. Stay healthy, stay informed, and I'll see you in the next video.